Hello, hello, hello. It is me, Dr. Catherine Toomer, here for Dr. Toomer Talks Show, and welcome. Um, so I am Dr. Catherine Toomer for any of you who are tuning in for the first time, and I'll reintroduce myself later as more people show up. But I am Dr. Catherine Toomer. I am a family medicine and community health physician and founder of Total Weight Care Institute. I talk about all things that are health, wellness, and weight care related, and I also help people who want a complete and compassionate answer to their weight health issues. And so I'm here today because one of the topics that comes up over and over and over again is menopause, is the weight gain around menopause. Now, one of the issues we run into with weight gain of menopause is very few doctors have learned about menopause when in medical school. Not only a few primary care doctors, more primary care doctors, more OBGYNs learn it than other doctors, but still not most. There's still a huge gap in our education, and that's across the board really for all women's health, because many studies have been overly weighted towards men. And so menopause is one of those issues. And so one of the things that are happening, you have some people out there who are very well versed. And when they are, um, and if you have a doctor who knows really well what they're doing, hold on to that person because it's not as common as you may think. So what menopause is a drop in the hormones that our body requires and for us to be fertile, for us to have babies, to make eggs so that those eggs can be fertilized. And that's estrogen and progesterone. Now, our ovaries also produce testosterone, which helps with our libido and muscle maintenance. But what estrogen and progesterone do is estrogen is required to allow for fertilization, and progesterone is what is necessary in order, well, for the estrogen for the egg production, and then progesterone is for the lining of the uterus for that egg to sit in order to get fertilized, or at least sit to develop into a baby. So over time, what happens as those hormones start to drop, women start noticing certain signs. One of them is irregular periods, menstrual cycles, uh, either shorter or longer or lighter or heavier, but they become very irregular. The other thing that starts to happen is hot flashes. And the reason hot flashes occur is because of the hormonal response to our hypothalamus. That is the part of our brain that helps regulate our temperature. And so when those hormones get reduced, our hypothalamus gets very sensitive, and it creates situations where our body thinks that we're overheated and tries to cool us down, opens up our blood vessels, and that's when the sweating starts. And anyone who's experienced that knows what that feels like. Um, and the other is that it does is it also drops our libido because our testosterone level drops, but it also starts causing muscle wasting. But the one thing that most people notice is their weight gain. And even if it's not actual weight in numbers on a scale, it's a change in body shape. It's a change in what happens to the size of our body, even if our weight stays the same. And so, cortisol, what happens when estrogen drops, our cortisol level, which is our stress hormone, you hear me talk about that a lot, our stress hormone becomes unopposed and it actually increases. And there's a few things that happen when our cortisol goes up. One, it disrupts our sleep. The other is, and just for those of you who are commenting, I will get to your comments, I promise. But I'm so good at losing my train of thought. I just need to keep going. Um, so hi everyone, thank you for joining me. Um, and so what it does is cortisol, it see, I told you I'd lose my train of thought. So, what cortisol does is it becomes unopposed. It increases in amount, and it becomes unopposed, and it causes all sorts of issues. And I've talked about cortisol a lot. It's the stress hormone. and what stress hormone does to the body. It causes insomnia, it causes um, insulin resistance, it causes all sorts of mood regulation issues and cardiovascular issues and small vessel issues. But the one that people notice the most, because it's the one thing that we can see the easiest, is our weight gain. And the reason that happens is it throws off our metabolic mechanisms that help us metabolize carbohydrates or starches. And when we have disruption of our carbohydrates and starches, as I've said many times before, that is how our body produces fat. And usually when that happens, it's not the nice, what's called the subcutaneous fat that our body makes, that's right up under our skin, that our body makes to keep us warm, and keep us insulated. It's the visceral fat. It's the fat around our middle, around our organs, and it lowers our organ efficiency. It also produces a layer of fat that becomes a hormonal organ in and of itself by putting out types of estrogen that aren't really bioavailable, but they do cause a lot of issues. The other, though, but with the insulin resistance, because every cell in our body has insulin receptors, when you have insulin resistance, it affects every cell of our body, including our brain. Remember, I talked about when you have insulin resistance, that means glucose, the signal that our brain needs to tell our body what to do, doesn't get into the cells. It doesn't get into the brain. And so the brain tells the body all sorts of odd things to do because it thinks something's off when it's not. So it tells you tells you to start eating more carbohydrates. It starts causing irritability, depression, anxiety. And then, of course, and then it starts sending all these strange messages to the rest of the body, telling what our gut to do, telling what our hearts should be doing, our kidneys, and all the rest. And so keeping cortisol levels down is extremely important. Um, and so these are the reasons that it's important to understand what menopause does. And it's important to understand that it's not as benign as some people may make it out to be, as if, oh, it's just normal passage of time, which it is, but that doesn't mean it doesn't cause some issues, especially in the Western world where a lot of the foods we eat, a lot of the preservatives, and a lot of the plastics that we eat our food in or packaged in are what are called not necessarily bioidentical, but they're hormone disruptors. That's the best way of turning it. They disrupt our hormones in a way so that our body does not react the way it's supposed to. And so when we go through menopause, often the effects it has on our end organs, particularly our heart and our cholesterol, and which, because our liver is one of the issues that one of the organs that gets affected, it really causes us a lot of problems. We have higher rates of heart issues when we go untreated. And so that brings me to my next point. I talked about how the cortisol makes your body produce fat because of the insulin dysregulation and the glucose dysregulation. But you can stop it and you can reverse it. It's not something that you just have to suffer through because of, what your really what many of us doctors kind of make women go through. I went through it myself. So the easiest way is hormone replacement. Now, there are some contraindications for hormone replacement, particularly family history of ovarian cancer, breast cancer, and others. But that's a discussion you have with your doctor around whether hormone replacement is appropriate. Now, keep in mind, there are different types of hormone replacement. There are topical hormone replacement that are just vaginal. There are, pill that have become systemic. There's also estrogen, there's progesterone, and there's testosterone. And any one of those, preferably estrogen, if you still have a uterus, you want to make sure that you also have progesterone as to oppose the estrogen so that your uterus stays working properly and also doesn't cause any type of lining issues. But that's again something you talk to your doctor about. So, hormone replacement is number one. And there are different ways of doing this. There are different types of doing this, of types of delivery mechanisms. Topical, you can do patches, you can do vaginal inserts, or you can take pills. But those are discussions you should have with your doctor. And the earlier, the better. The earlier you have hormone replacement, as soon as your periods become irregular, as soon as you start noticing you're having any of the side effects of increased cortisol, like sleep disruption, like hot flashes, then it's time to have that discussion with your doctor. And if your doctor doesn't know what to do or understand it, then just find another. It doesn't mean you have to give up that doctor. Just find a doctor that understands it and maybe just go to that doctor for your hormones. The other is muscle building. Now, I've talked about this a lot. The earlier you start, the better you will be. When you start early, what that does, it helps preserve your testosterone, it helps preserve your strength, it helps preserve your muscle mass. And so that later on, it helps with your mobility, it helps with your balance, it helps with your overall strength and sense of well being. Your independence later in life is dependent on your muscle building now. And I'm going to repeat that. Your independence later in life is dependent on your muscle building now. The earlier, the better. Now, that's not to say if you've already been through menopause, you can no longer build muscle. That's not true. We've all seen 80-year-old muscle builders. So we know that that's not true, but it does take a little bit more dedication and a little bit more consistency and sometimes a little more intensity when you're building muscle at an older age, post-menopausal, or even so as you get closer to menopause, the harder it is. The more work, not say the harder, the more work you have to put in order to get that muscle to grow. And then the other is to keep your cortisol levels down in any way you can. Meditation, mindfulness, exercise that helps reduce, improve your moods and bring those cortisol levels down, like walking, low impact exercise, walking, Pilates, yoga. All of those things are really good at keeping cortisol down, but it's also very important. So when people come to me for weight loss and they're saying that they're starting to grow through the middle, it's almost impossible to reverse that as long as cortisol levels remain elevated. They have to come down. Otherwise, that growing of the abdomen that's growing will always be there because that's where cortisol makes the body deposit fat. And so the three prongs have to happen. Otherwise, one of them is going to outdo the other two. So again, that's medication, hormone replacement, muscle, and getting cortisol levels down. Now, one of the things that is also something to take into consideration is, your family history, your age, your comfort level in having, taking pills versus using something topical. And so those are all very important things to take into consideration and talk to your doctors about when talking about hormone replacement or your menopause in general. Because, but again, if left unaddressed, it puts you at higher risk for estrogen-related fat production, which is not a good estrogen-related fat production. It's not the bioavailable estrogen. The other puts you at higher risk for cardiovascular disease, for heart attacks, for strokes. And so it makes more sense just for prevention. But one of the issues we also run into is that, excuse me, we have a limited opportunity to treat in other ways. One of the things that I have been doing, and it is something that I'm sure will one day become standard of care, but it is not, and it's something I do off label, and that is I use GLP-1s for women because right now it's so rigid in our what can I say? The guidelines for when GLP-1s can be used are very, very rigid. It's based on BMI and it's based on hemoglobin A1C. However, when someone has polycystic ovary syndrome or they have menopause, we know they're in insulin resistance. We know that they have glucose dysregulation. And unfortunately, sometimes our hands are tied in being able to use any type of medication to correct that. Um, Metformin can be helpful, although I find that GLP-1s work far better, low dose. So, um, I'm going to go through some of the questions right now. And for those of you who are joined and didn't know who I am, I'm Dr. Catherine Toomer, family medicine and community health physician and founder of Total Weight Care Institute. And good afternoon. Hello, Patricia. Hello, Tawana, Dr. Gilliard. Um, Kristen, thank you for coming. Shamika, Chris, and Jennifer. So Kristen says, "Hi there. Finally started Zepbound yesterday. Slight nausea, a little tired, but nothing like Wegovy so far. Good. It usually is. I just find that the side effects for the tirzepatide, which is what Zepbound is, versus the Wegovy, which is the semaglutide. Semaglutide just tends to lend itself to higher side effects, um, and for whatever reason. Jennifer says, my primary physician has not allowed HRT. I've asked. I'm now 60 and having issues. Listening to you and others has led me to seek a menopause specialist. I go early next month. Thank you. Great. Um, you know, I'm sorry. That's all I can say. I'm really sorry because you should have been asking. Um, you should have been uh, put on something earlier, but it's not too late still. Even at 60, it's just not too late. I hope not. I'm at 58, so we're all in the same boat. Kristen said, when I listen to you, it makes me feel like I'm doing the right thing. Praying this is my answer. Well, I hope so too. And this is why it's so important to have a partnership with your physician, so that when you go through your changes, when you go through any decision-making process, that it's a partnership between you and your physician, and educate yourself. Take a pen and paper. When your doctor says something, write it down. If it's a word you don't understand, either ask them to explain it, write it down, and look it up later. Um, Always do your own research. Now, of course, Dr. Google is not always the best, but it will at least help you figure out um, different ways of advocating for yourself and maneuvering through the system. Chat GPT is also another good place. It's AI, and you can just ask questions. If I am of this age and I have these symptoms, what type of doctor should I see? Or what questions should I ask my doctor to make sure that I get the medication I need? How do I advocate for myself? These are all questions you can ask, and you can you don't have to take the answers you can, of course, critical thinking, you can use them or not, but at least it gets you on the right path. Okay. Um, any other questions? Okay, well, again, I am Dr. Catherine Toomer. Thank you so much for coming. I appreciate it. Um, and it says, what is a GLP? I'm on Wegovy and metformin. Okay. GLP stands for glucagon-like protein. Wegovy is a GLP. It's a class of medication. And so the class of medications are there's but the old ones are Bydureon and Byetta, and then we had Victoza, then Saxenda, then we had Trulicity, and then Ozempic, Wegovy, and Mounjaro and Zepbound. Those are all GLP-1s. GLP-1s do a lot of things. They get a lot of press for their weight loss properties, but remember, weight gain and loss is a symptom of something else going on, of a metabolic process, and GLP-1s treat that metabolic process. And so that's what they are. And yes, Wegovy is a GLP-1. It's just a class of medicine. All right. Well, Thank you for coming. Hello, Dr. Una. Thank you for showing up. Um, and if you have any questions, again, you can do a couple of things. If you have questions and you want to get answers, you can join my group, which is Facebook. It's facebook.com/groups/total weight loss. If you join my group, I'm always in there. So if you post questions, I will see them and I will answer them. That's the best way to get access to my information. The other is you can subscribe to my YouTube channel. And a lot of the videos, of course, are from these Tuesday talks, but I also do others, and I have others from before that you can go through and sometimes find the answers that you're looking for. But those are the two best places. And if you want to work with me, then it requires an appointment for consultation. And you can get that through my website, through contacts of my website. Just say, I want to talk to Dr. Toomer, or you can call my office and the number's on there too. So, and they'll give you an appointment. So, well, thank you for coming. And I appreciate it so much. And I will be here next week for another episode of the Dr. Toomer Talks Show. Good night.